Hi, I'm Marna Rasmussen. I'm an acupuncture physician here in Winter Park, Florida, and I'm here today to give you instruction on the Avazzia microcurrent units and allow you to feel more comfortable with these wonderful products so that you might be able to use that information for your patients with the Click to Scripts program platform. So what we're going to do today is understand what the technology is, how it works, what the expectations are, some of the contraindications, and how to get the best patient outcomes that we can. So further ado, we'll just get right into the training. The whole idea behind the Avazzia is that we have a non-toxic, non-invasive, and non-pharmaceutical product to treat pain. It's a bioelectric stimulation technology. And I'm very excited about this. I think you're going to find that this is going to help your patients and going to help you help a lot of people stay off of narcotics and other drugs. So the objectives for today's training are to have you be clearly aware of any contraindications or precautions for the application of this device, to understand the technology of Avazzia, to know the clinical applications and the expected results, and to understand the different Avazzia products so as to best advise your patient on which is best for them. So there is an FDA clearance. These are Class 2 devices, which is why it does require a script. We have the Avazzia's ProSport Ultra, ProSport 3. These are primarily used by practitioners. Then we have the home units of the RSI, the Best Pro 1, and the Avazzia Blue. These devices and the accessories are all cleared as Microcurrent TENS devices for symptomatic relief and management of chronic pain, intractable, and adjunct treatment in the management of post-surgical and post-traumatic pain. So the contraindications are very simple. Pacemakers and other electrically powered implanted devices that can't be deactivated during treatment. And you do not want to apply this over the carotid or sinus nerves. And it is contraindicated for pregnancy or any undiagnosed syndrome. So you really want a diagnosis prior to any of this. That only makes perfect sense. So the contraindications are really quite few. So what is the need for this technology? You know, what is this all about? Well, the need is based in the crisis mode of pain management. Right now, prescription drugs cause more deaths than street drugs. Americans consume 80% of the world's medications, and we're only 4.6% of the world's population. We have a major need for treating pain in a non-invasive, non-pharmaceutical fashion. There is a pain management epidemic. It affects more people than diabetes, heart disease, and cancer combined. Back pain affects 8 out of 10 people at some point in their lives, and the chronic pain has a huge price tag. Chronic pain costs the U.S. economy $150 billion a year. And if you want more information, please go to any of these sites because the statistics are only climbing. Now, drugs aren't the answer, and prescription narcotics and OTC painkillers are not a good long-term solution. So what is the answer to natural healing without unwanted side effects? And that is electricity, specific electricity. Tim Smith is our CEO and founder of Avazzia. He's quite an amazing man. Got multiple degrees from Southern Methodist, 45 years experience for Texas Instruments, and designed the logic chips for NASA space programs, Apollo space missions, military jets, while working for Texas Instruments, and his chips were in the early Apple and IBM systems. So this man knows electricity and microprocessors. So what is this microcurrent technology? So basically, microcurrent uses extremely low-level electric currents, called microcurrents, to treat nerve and muscle pain and inflammation and other health challenges. Each tissue has its own specific electrical frequency, which may be disrupted by injury or disease. This means that bone has a frequency, muscle has a frequency, nerve has a frequency, and so what we want to do is normalize these tissues. So microcurrent therapy simply restores these and normalizes the frequencies within the cells, resulting in that reduction in pain, reduction in inflammation, and increased function. So Avazzia's technology is a little bit different than basic microcurrent because, yes, it is also transcutaneously communicating with the nerves for the purpose of therapeutic intervention, but it's using a high-speed microprocessor. This is amazing, this establishes a cybernetic loop between the machine, the Avazzia device, and the body. And the body's response is truly measurable, creating information for the loop. In reality, every second there are up to 3 million calculations being done as that device is placed on the skin. So it's constantly establishing this informational loop and ever-changing loop. So how does the body respond to the stimuli? It does so by releasing neuropeptides that include neurotransmitters, endorphins, natural opiates, nitric oxide, and anti-inflammatory factors. So it's having profound physiologic changes in the body. And so how does this move through the body, this electrical stimuli? Basically, it's moving through the connective tissue, the fascia, anything that is highly hydrated, all of that liquid crystalline structure. And I'm going to talk a little bit more about that now. Dr. James Oshman, he was a biophysicist, and he has some really amazing information out there. He's got this picture of fascia, and his state is that fascia forms the largest system in the body. And as this system touches all other systems, fascia is connective tissue. It is highly hydrated. And this is the part of the connective tissue that we're using as our pathways for the electricity. Another doctor, Dr. Gimberto, has wonderful videos online, and you can see that he's taken a micro camera and put underneath the skin. It's called Strolling Under the Skin, and you have a picture here that shows you the matrix of collagen or connective tissue, and it's these very hair-like fine fibers that have water permeating throughout them. And so this whole matrix, this liquid crystalline matrix, is basically a high-speed signaling network that is using biophotons and electromagnetics right through the crystalline structures in the collagen. So this is how the electricity moves through the body. Another doctor, Dr. Mei Wan Ho, kind of explains how this works and why this starts to make differences in the tissue as you're using these microcurrent therapies. So what she's found is that the water that is bound on the surfaces of proteins and membranes, and this conducts positive electricity, enabling the cells and the tissues to communicate very rapidly and efficiently. So with better communication, you have better perfusion, better blood flow, and you start having tissue changes. So basically the body matrix is the connective tissue in the body. Your body is an electromagnetic system that functions as a human biocomputer which communicates via microcurrents. And microcurrents are really important. It's not other type of current, and we're going to talk a little bit about that as well. So what happens in this matrix when there are malfunctions? What's going on because of trauma or disease? Well, what happens is that many of you can remember this back from college days where you had the old coloring books, but this diagram is basically a picture that shows the capillaries, and you've got the capillaries, you've got your organ cells, you've got all sorts of toxins built up here and there, you've got lymphatic flow here, you've got your nerve cell down here, and when you've got things that become very congested, when things aren't moving freely, the lymph isn't moving in and out, toxins aren't being pulled out of the cells, and the blood flow is not moving in and out, nourishment's not happening, nerve function is not happening correctly. All of this is going to lead to that puffy swelling edema and a great deal of pain. So this is what the Avazzia is treating, is this congestion, this lack of communication, and the inability to remove toxins from the cells. So what's so important, the one thing that is so important for this technology to work and for people to function properly is to stay hydrated. So reminding your patients and your family members that they need to hydrate. This isn't going to work if they're highly dehydrated. In fact, in my clinic, if people are not, one of the first things I do before using the Avazzia is give them a glass of water, because it makes that much difference in the treatment outcomes. The other thing is that I really educate them about making sure they're drinking enough water. So being hydrated is really critical. We lose so much of our water as we age, and so it's critical to maintain that level. And without it, you're not going to have the optimal outcomes. It really does require the adequate hydration for a good outcome. So drink up. Now, another thing that is unique to the Avazzia is what we call neuromodulation technology. So the Avazzia actually is working with the neuroendocrine system through direct contact with the skin, through the direct contact of the skin, through stimulating the nociceptors. Now, we'll take you back here about nociceptors. Nociceptors are what are providing those pain relays. There's a harmful, you crush your finger or pinch your finger or whatever, and so it's sending it through the peripheral nervous system to the brain and back again. So that's what the nociceptors do. But they also play a real critical role in the process of wound healing. And so you want to stimulate these fibers, and I'm going to tell you a little bit more about that too. So the peripheral nerves are activated, with the Avazzia devices. Now this is a basic pain gate that has been around since the 60s, this picture here. And it shows the signals, and you've got the A delta nerve fibers causing that intense pain, and then the C fibers with that throbbing, diffuse chronic pain. And so these are the ones that are really, really well treated with the Avazzia. So it really is making sure that these are not suppressed. And I say that because of this slide here. Traditional TENS units with Millicurrent. Millicurrent are basically what's on the market all over the place. Shack is now promoting I think it's Aleve. It's one of them. Bayer product, something like that. There are little TENS units that you stick on your back and you can leave them on to treat pain. Those are Millicurrents. They actually stun the nerve sheath. That's technology from the 60s. It's old school. It's cheap, probably $30 to $50. Yeah, it does suppress some pain signals from the brain, but only as long as it's on there, and it's not safe to have it on there for more than 20 minutes because of the stunning process. So what happens with TENS units when they are using Millicurrent is that you actually are suppressing the A delta fiber nociceptive processing. So that hinders the healing process. This is a real important piece. The old school stuff actually slows the healing process down. So you don't want Millicurrent. The studies are there. So the other piece that's unique besides the nociceptive component is the fact that we use sinusoidal waves. Sinusoidal waves are much more attuned to how the body electrical system works. Whereas traditional microcurrent or millicurrent TENS units on the market use square waves or rectangular waves or sawtooth waves or triangular waves, anything other than how the body is actually set up to work electrically. So this is a real important piece. The other piece here with the Avazzia is that you see how many volts occur initially. That's 204 volts. It's for a very, very short amount of time. But what that does is allow for deep penetration into the tissue before then having the regular sinusoidal wave kick in. It's analogous to inserting an acupuncture needle. So it's that quick, high volt into the deeper tissue. So here is a really important comparison. So traditional TENS using milliamps are on the left, and the Avazzia's best here is on the right. So you can see we're using milliamps versus microamps, so that's a huge difference. Square wave, Avazzia has the sinusoidal waveform. Traditional TENS no biofeedback, that's that cybernetic loop. Avazzia's best has the biofeedback loop. Because of that biofeedback loop, Avazzia's products have no habituation. which means you can use them longer. Traditional TENS, you habituate to it, which is why they tell you do not use them for more than 20 minutes or so at a time. So that no habituation is a real important piece. What's happening is that you are continually keeping the brain engaged with the stimuli and the tissue that you're treating. It's a key piece to why this works so well. That and the constantly changing waveform from that cybernetic information allows for this no habituation. Again, that high voltage that I just talked about, Avazzia has that initial high voltage getting it into the tissue. Traditional TENS does not. The traditional TENS temporarily blocks the pain signal as long as you have the unit on, but as soon as you take it off, within a short period of time, the pain does return. With the Avazzia, it does stimulate the A and C delta fibers to release the opiates and promote wound healing. It does promote tissue changes in the body. So it's not just about the endorphins being released. There is little or no manufacturer support with the traditional TENS. Avazzia Best has continued support, product education. The practitioners that are using these in their offices, these products in their offices and making them available to their patients are all educated. They're all training their patients on using this. So this is not something that is something that can ever be sold at CVS, because it requires an understanding to have wonderful outcomes in treatment. Okay, so in a nutshell here, we've got the physiologic benefits of the Avazzia's technology. So the biggest deal here is this application to the skin that increases the perfusion of blood and circulation. So you've got improved circulation, microcapillary function. You've got increased improvement in lymph circulation. So most people, you know that lymph doesn't move if the people don't move. Well, people who are in pain don't move much. So lymph is just gathering up in the body. And so using the device helps move the lymph through, getting that proper circulation, getting rid of the edema, and restoring normal electrodynamic properties to the tissue and normalizing cell signaling. It also will allow for increased neuropeptides. The pain management is significant, and believe it or not, everybody who uses these units has this sense of well-being that occurs with the unit. There is just a generalized feeling of well-being. It's not like they can pinpoint it. Their pain may not be 100% gone, but they know that it's working for them. They feel better, and they consistently say that. So I'd like to continue with the testimonials. Now, some of these pictures are going to kind of blow you away. They sure did when I first saw them. So this is a 90-plus-year-old gentleman who fell and did a face plant and came into his chiropractor's office down in Texas. And obviously, you can see he was pretty banged up. And he was very concerned because his son was going to come and visit the following week, and he was really worried that he might end up having to go into some kind of assisted living or some kind of facility. And so the doctor started him on treatments, daily treatments. And after 3 days, you can see that the abrasions have healed up dramatically. The swelling has gone down. It's already in 3 days. That's an amazing, I mean, for a 90-year-old guy, that's pretty amazing recovery time. And then after 5 days, there's only a couple of little remnants of some of the bruising left. So this is, to me, it's like magic. It really is amazing how effective these treatments can be for people, and life-changing. Here's a spider bite. This was a brown recluse spider bite. This woman was in the hospital for a week prior to day 1's pre-treatment. And they had her on all the antibiotics they can do, and she was very close. They were saying that she was going to lose her hand, and because they could not stop the necrosis. And so she came into the chiropractor's office, and he put the Avazzia on her. He used pads, and he put the pads on her fingers and then above the wound, and he treated for 24 hours a day. Now, you can't do that with any other current, and you can do that because there's no habituation. he used the program RSI, and you can see the improvement in each day as it went on for the first week. It's pretty dramatic, and this is even more dramatic. That's 3 weeks later. And so, you know, a woman who basically Western medicine was pretty much given up on being able to treat that toxin. And this is a way of allowing the body to heal itself. That communication had to happen and stop that neurotoxin, that toxin from preventing the communication. And so this worked very well for her. Here's a basic trauma. Fell in the parking lot and hit her head on one of those parking lot cement blocks. Got a nice goose egg, number of stitches. And this is just the next day. I think it was just two treatments with it. And the goose egg is basically gone. Of course, she showered and got rid of the blood. But essentially, you can tell that the hematoma is pretty well resolved. So it's amazing how well it can work. And this is just a reminder as to how important drinking water is, and I can't stress it enough. Keeping hydrated with this technology is really important. In fact, we did a little test. We have a means with the professional units of taking readings. And so if we don't get a reading in the reaction mode of at least right around 19, 20, 21, the person isn't very hydrated. And so I just hand them a glass of water. They haven't even drank the water. They just hand them the water. Take another reading while they're holding the water, and it's already jumped up. Then they drink the water, and it jumps up. So it's truly important that people hydrate for the electrical process to do its job. So I can't stress that enough. Now, I want to get into some of the products that Avazzia has so that you can better understand what would be the most effective for the patient that you're going to be working with. First, I'm going to start with the professional units. The ProSport 3 has 52 different programmed modes, and it has all of the acupuncture channels, all of the chakra modes. It has solfeggio. It has the earth frequencies. It's got brain frequencies, and it has the basic pain and scar release protocols. This is the Mac Daddy. This has everything. It also has what we call Ava, and it has the pre-programmed that you can scroll through a frequency if you want to pick a frequency. So it really basically has everything. And it comes with all of the accessories, the Y-bar, a brush, the AcuPoint pencil, and leads to use pads. So you can use 2 or 4 pads at a time. They're all battery operated. They take AA batteries. I prefer using lithium batteries, but it's not required. You can use good old Duracell. Do not use rechargeables, but the Duracells are fine. The other professional model is the ProSport Ultra. This has 13 protocols and that same Ava mode setting where you can scroll through. And it has all the same accessories. And so you're going from a strong price point, you know, down as we go down. They both have this display and reactions on it, so it's got an LED readout. And we have trainings on this, so have you understand what all of these digital readouts mean and how it affects your treatment. And so that's a part of the advanced training, and so we would hope that you would take the time to take our trainings and be fully trained in using these units as well as just understanding them. Now the home use products are the best RSI and the best Pro 1 and the little blue Avazzia. Now the best RSI is probably the most common sold because one of the big users of the RSIs are people with neuropathies, and it has the mode. The RSI mode is the mode you need to treat neuropathy, and so that's one of the indicators right there as to which unit you might lean toward for the patient. If they are dealing with forms of neuropathies, you want the best RSI. The Best Pro 1 is wonderful for basic pain, scars, post-surgical, traumatic pain, sports injuries, anything like that. The Best Pro 1 is wonderful. It's a great unit. They both have a simplified means of following a reaction with bells, the little buzzes and lights that light up and things like that that are indicating how the treatment is progressing while it's on the skin. And so they have the same patented biofeedback technology, the same cybernetic loop, the same process is all there. They have all of the same things where they will not habituate. It's all the same as the professional models. The professional models are a little stronger because they have more that they have to do, but it's the same technology. And the last one, the little blue one, is only got 2 modes. It's got blue relax and blue stimulate, so it can be used for basic arthritic pain, any kind of overuse, strain, sprain, that kind of thing, and scar release. So it's a real no frills kind of unit, and it is the cheapest unit that we carry. So the accessories, we have a 2 and 4 pad lead, so you can either use 2 pads at a time or a 4. They all come with the 2 lead. If you choose to have more, then they have to order that 4 lead pad. They're $25. They all come with 1 set of electrode pads. The home units come with the Y bar. The AcuPoint and the brush are extra. And so basically, how does this technology, how do you use it? What do you do with it, this little tiny unit? So basically, you turn it on, and you place it on the skin. You power it up until you start to feel a little of the electrical going through. It's usually a slight buzz. And then you choose which mode you want to work with, depending on the unit that you're using. And when you apply it, you can apply it in a stationary, which we call park. And you can just do on trigger points, on sore spots, anything like that. Or you can paint. And I recommend people start painting over an area. Say if you've got an elbow pain, you paint, north, south, east, and west over the area. And then you can go into more in-depth treatments with it, using specifically parking it on areas of pain. Then if you have the professional unit, you can use the reaction modes, and that takes you to another level. Basically, you're going to be looking for a couple of things to know if you have active zones on the body. It can be color of skin, and that can change. It can already be red because they've got some kind of inflammation process going on. And then that could change as you are treating it. It could get redder, or it could get paler. It could happen either way. You're going to have some friction, so frequently it gets pinker just because if you're moving it up and down, you'll have some friction, so it will get a little bit pinker usually. But one of the units, one of the assessments is the sound the unit is making. And each of the modes, they each have a unique sound. And so if you're going over it, you might hear just a little tiny faint buzz, and then all of a sudden it goes, and you'll hear it quite loud. When you go over it and it increases the sound volume, you're on an active zone. And that kind of gives you parameters of what you're working with. And it may not be right where the pain site is. And this is the important piece about it, is that the machine will help tell you where to be working. It's what makes it so user-friendly. There's also what we call a stickiness factor. And this is, it's an amazing thing. The impedance is felt as you move the unit over the skin. And it literally drags. You get into an area of high impedance and it just sticks. It just doesn't want to go. And you know that you have to work that area. Another assessment besides those first 3 is sensitivity of the skin. So when you are using the intensity button, you may, as you go over a really sore area, it may become either less aware of the electricity or more aware of the electricity. And so you may need to adjust temporarily some of the intensity. And that's because of these areas that are active. There can also be a primary sign. And the primary signs are things that could be there prior to treatment. You know, they could be redness, itching, dryness. The texture could be different in the skin. These are areas that already are telling you there's something happening here. And so the likelihood is you're going to have a higher impedance. So again, with the terminology that you're assessing the area, you're looking for color of the skin and how that changes as you work the area of pain. The sound or buzzing or humming that comes from the skin surface by using the device along the area. And the change in that sound, it could be louder or quieter. And these are all indications of active zones. The stickiness of the skin, and sometimes it is so sticky you have to plant it because it just won't move. And so you plant it there for a while and then you go and move around it. The sensitivity, as we said, of the patient, so you need to just work with their comfort zone. More is not better, so you just work with that intensity level and have them realize that. And then again, the primary signs. So, in the case of stickiness, you always want to work in the direction of the most stickiness. So if you're working up and down the arm and there's no drag, and then you go across the arm and there's a great deal of drag and it just doesn't want to go, that's the way you want to be continuing to work. You want to work in the area of the maximum stickiness. So in clearing scars, this is one of the most exciting components, and it's what got me involved in this, is because I watched a person's transformation right in front of my eyes. And so what got me involved in using and purchasing an Avazzia myself for my practice. So clearing scars, I've used other types of microcurrent to clear scars, but they were not comfortable for me, having scars cleared on me, or when I would do it for other people. Clearing scars with the Avazzia is painless. It is so wonderful. It does not hurt at all. And so realizing that any surgical scars or traumas have a great deal of impedance involved in that healing process. And it's not just where the scar is. You know full well that the adhesions come out several inches from the surgical site. And so those adhesions are that stickiness. It's where that fascia and all of that connective tissue kind of gloms together and doesn't allow for proper blood flow or lymphatic movement, and it tends to get hard and lumpy, can be painful. And so what you really want is to open that up. And in terms of Chinese medicine, for me, those scars literally cross channels, and so it blocks the flow of the qi in the channels. So for me as an acupuncturist, being able to release these scars on my patients is most effective in normalizing their communication in their body again. So this picture is showing you a 6-week-old hip replacement scar. And on the left, you can see the new scar, how deep it really is, and red. And then and the swelling and hardness of the tissue. And then on here on the right, you can see how it's flattened out. And this is 2 treatments. This is just 2 treatments using Blue Relax mode and the Y-bar, okay? Now, when treating scars right after surgery, you don't want to treat, you want to wait 6 weeks to actually treat the scar itself. You can treat around the area right away after surgery, but you don't want to treat the scar itself because you're wanting it to form. You want those fibers to really form to create that proper matrix, and you don't want to disrupt that process. So that takes about 6 weeks that you want to wait before you actually work the scar itself. You can still work the surrounding areas with other programs. Here's an old scar, and so this was 3 treatments, and it dramatically changed the look of this guy's face. You can see the depth of that scar and how it has just smoothed out. And you can also see, because it's not quite as evident as it is on the computer, but there's a little bit of redness in here, and that's because they were stroking over the top of the area, and so there's a little bit of pinkness there, just like in his ear, because we really moved the lymph and the blood in through that area and helped to reorganize that tissue. Here's a simple post-surgical scar that had keloided pretty dramatically right on the neck, and after it's practically gone. It really is quite dramatic. Okay, so there are specific factors that can affect the healing of tissue and the scar treatment results. And so you'll need to keep these in mind if you've got patients that are saying, I really want this unit because I've got this scar and I want this to be resolved. So things that can affect that are infection. So if there's ongoing infection, that can affect the results that we're looking for. So that's one thing. If the area that you're treating has been had repeated surgeries, like C-section lines, or they have practically a zipper, where they've had multiple C-sections or something of the sort, that can make it a little more difficult to resolve. It's not that you're not going to get some results. You will. It will definitely smooth out and change, but it may not be to the degree that it could be if there hadn't been that many surgeries. Nutritional deficiencies can affect it. So if there's protein, vitamin C, copper, other nutrients, things like that can affect the ability of the tissues to heal well. One of the things that is really important is whether they have a very high carbohydrate diet, excessive sugar, that increases the inflammation in the body, and that also does slow down the ability for these scars to be resolved. And so what I've done with people with that kind of a background and that kind of a lifestyle is that I let them know, I say, if you really want this to resolve better, you've got to change your diet now, and in a few days after we've gotten this regulated, then we can come back and we can start getting the communication through those tissues that we want. And so you have to educate the patient a little bit about expectations and that they have a role to play in it, not just being hydrated. So if they're drinking a lot of soda pop and they're eating, refined foods and things like that, it's going to play a role. Genetics. Some people have the propensity of having greater keloids, and there's not a lot that can be done about that. However, I must tell you that even though they may keloid heavily, it doesn't mean you can't help them. I had 2 athletes that were both members of a fraternity, and they had been branded, one on the chest and one on the arm, and it was about the size of the palm of your hand. It was a big brand. So they literally burned themselves, and they were both of African American descent, and they both had very high keloids. I mean, it was raised up probably ½ an inch from their skin. And so this scar was pronounced. I mean, it was big. And I was able to reduce them down in 2 treatments. I reduced them down by 50%. Now, they didn't continue with it, but had they, I don't know how much farther I could have gotten. It's hard to judge. But you can help even extensively keloided tissue. I do know that has genetics as a part of that. Smokers block the communication, and so they will not have as good a results as non-smokers. And other diseases such as diabetes and other diseases that are going to have high inflammatory responses, like lupus or some of these other ones, because if you've got to have that communication. It doesn't mean that it won't help. It will help. It's just that you have to have reasonable expectations with it. So they do affect the results. It doesn't mean that it won't make a difference. It's just how much of a difference it can make. So how do what are the protocols and treatment times and things? I want to reiterate this because this is important for scar clearing. On a new wound or a new surgical site, you want to wait 6 weeks for the initial scar itself to form. You want to allow those fibers and fibrinogen to all do its thing. And then you can work right over the whole scar itself. Before that, you want to work above and below, promoting healing. Old surgical scars, you know, you have to realize that old surgical scars is not just where the scar is. You want to treat way out. So if there is abdominal scarring, you don't want to just work, you know, right around the scar. You want to come out. You want to go into the other parts of the abdominal cavity, because if they open that abdomen up, they opened it up. All of that fascia and that connective tissue has been affected, and it's going to be sticky in there. And I tell you, if they've had arthroscopic work done, you know, if they've had things going inside of them, moving around inside underneath the skin, that's creating more and more adhesions. So you want to look for those hard areas and clear those as well. So those are actually scars, even though it's not a slice and they went in and are digging around underneath. So in the acute phase of a wound, you want to use either the acute or acute trauma on the professional models. Those work very well above and below the site. Otherwise, you want to wait that 6 weeks. Now, another piece that's really important and I talked about this earlier, it's one of the big reasons for people to get these units is because they suffer with neuropathy. And that could be chemo-induced, that could be diabetic-induced, it could be idiopathic, they don't know why. And the protocols work across the board for the most part. I'm not saying 100%, but they all seem to improve. To what degree is going to depend on how badly the nerves obviously have been damaged. And one of the protocols is to use the RSI mode. Now, for a home unit, there is only one home unit, the RSI, that has this mode. And so you want to move your patient into that particular model. And you use 4 electrodes running from the lumbar to the feet, and it's a daily treatment. And so they realize this is something you need to do for 20 to 30 minutes every day, longer if they can. And it does work. I have had multiple patients have wonderful responses using the RSI for treating the neuropathy. So if you have additional questions, you can always reach me. My website's up here. My phone number is here. You can reach people at First Alternative Therapies. You can reach people at New Wave Biosciences. But I think this will give you a good understanding as to what these products can do. And I really hope that you take the time to do a full weekend training with us so that you personally can use the unit, see how it's done, and have a hands-on experience. And thank you very much for your time.